More than 20 million Americans suffer from anxiety, an unpleasant emotional state that can range from mild unease to intense fear. Anxiety differs from fear in that while fear is a rational response to a real danger, anxiety usually lacks a clear or realistic cause. Though some anxiety is normal and even healthy, higher levels of anxiety not only are uncomfortable but also can lead to significant problems. Anxiety is often accompanied by a variety of symptoms. The most common symptoms relate to the chest, such as heart palpitations, throbbing or stabbing pains, a feeling of tightness or inability to take in enough air, and a tendency to sigh or hyperventilate. Tension in the muscles of the back and neck often leads to headaches, back pains and muscle spasms. Other symptoms can include excessive sweating, dryness of the mouth, dizziness, digestive disturbances and the constant need to urinate or defecate. Anxious individuals usually have a constant feeling that something bad is going to happen. They may fear that they have a chronic or dangerous illness, a belief that is reinforced by the symptoms of anxiety. Inability to relax may lead to difficulty in getting to sleep and constant waking in the night. Causes: clinical anxiety can be produced by psychological problems as well as by biochemical factors such as caffeine, certain other drugs and the infusion of lactate into the blood. The fact that the compounds can produce anxiety can be put to good use in understanding the underlying biochemical features of anxiety. Perhaps the most significant biochemical disturbance noted in people with anxiety is an elevated blood lactic acid level and increased ratio of lactic acid to pyruvic acid. Lactate, the soluble form of lactic acid, is the final product in the breakdown of blood sugar, glucose, when there is lack of oxygen. All of this biochemistry plays a role in anxiety, because of the elevated levels of lactic acid in individuals with anxiety when compared with normal controls. Furthermore, if people with panic attacks get injected with lactate, severe panic attacks are produced as a result. In normal individuals, nothing happens. So the conclusion here is that people with anxiety may be sensitive to lactate. In other words, lactate may be causing their anxiety. Reducing the level of lactate is a critical goal in the treatment of anxiety. How to reduce anxiety? Firstly, please make sure to watch our video on stress relief because it covers the main treatment options if you suffer from mild anxiety. If you suffer from moderate to severe anxiety, then follow the recommendations provided in this video. Due to the elevated levels of lactate found in individuals with anxiety, the main goal here is to reduce the amount of lactate via nutrition. There are at least 6 nutritional factors that may be responsible for elevated lactate levels. 1. Alcohol. 2. Caffeine. 3. Sugar. 4. Deficiency of the B vitamins, niacin, pyridoxine and thiamine. 5. Deficiency of calcium or magnesium. 6. Food allergens. By avoiding alcohol, caffeine, sugar and food allergens, people with anxiety can go a long way toward relieving their symptoms. Simply eliminating coffee can result in complete relief from symptoms. This recommendation may seem too simple to be valid, however substantial clinical evidence indicates that in many cases it is all that is necessary. For example, one study dealt with 4 men and 2 women who had generalized anxiety. Their caffeine consumption ranged from 1.5 to 3.5 cups of coffee per day. Avoiding caffeine for 1 week brought about significant relief of symptoms. It was so noticeable that all patients volunteered to continue abstaining from caffeine. Before this, the patients had been only minimally helped by drug therapy. Follow-up exams 6 to 18 months later indicated that 5 out of the 6 patients were completely without symptoms. The 6th patient became asymptomatic with a very low dose of Valium. By following the guidelines in the video called, "The Best Diet for Optimal Health," and taking the right supplements, you will provide your body with the kind of nutritional support it needs to counteract the biochemical derangements found in patients with anxiety. Note: if you are currently taking a sedative, hypnotic or antidepressant drug, you will need to work with a physician to get off the drug. Stopping the drug on your own can be dangerous, you absolutely must have proper medical supervision. Nutritional supplements. A high-potency multiple vitamin and formula. Fish oils, 1,000 to 3,000 mg EPA and DHA per day. Flaxseed oil, 1 tablespoon per day. One of the following: grapeseed extract, 100 to 300 mg per day, pine bark extract, 100 to 300 mg per day, or some other flavonoid-rich extract, super greens formula or another plant-based antioxidant that can provide oxygen radical absorption capacity ORAC of 3,000 to 6,000 units or more per day. Botanical medicine. One of the following: Panax ginseng, Chinese or Korean ginseng, high quality 1.5 to 2 grams 1 to 3 times per day. Siberian ginseng, dried root, 2 to 4 grams 1 to 3 times per day. Rhodiola rosea, Arctic root, for a dosage target of 3.6 to 7.2 milligrams rosavan. The daily dose would be 360 to 600 milligrams for an extract standardized for 1% rosavan, 180 to 300 milligrams for 2% rosavan and 100 to 200 milligrams for 3.6% rosavan. Withania somnifera, ashwagandha, 125 to 250 milligrams per day. Please consult a natural health doctor for a treatment plan that will work best for you and your needs. Effective treatment for anxiety must address psychological as well as physiological factors. In that regard, it is important to follow these recommendations. Reduce or eliminate the use of stimulants. Follow the dietary guidelines from the video called The Best Diet for Optimal Health, as well as the video called Stress Relief Tips on How to Manage Stress. We hope these recommendations help you with your anxiety. Please like and share with someone who needs to see this. Don't forget to subscribe for more helpful videos like this. Sending you lots of love and light.